The We Care campaign was started in 2011 by VNA of Ohio staff members after they started noticing that many patients' homes didn't have things like food, hygiene products, and other basic necessities. How were patients supposed to focus on their health care when they were worried about where their next meal would come from? The fund was meant to support patients and their families in times of crisis. So far this year, we've already disseminated nearly $1,500 to 11 patients and families for groceries, to prevent electricity being shut off, for medication assistance, furniture, and transportation. We want our patients to be able to focus on healing.
Many of my patients have benefited from the We Care Emergency Assistance Fund. A patient I had, 74 years old, had interstitial lung disease and was homebound. The fund allowed us to give him what he needed to be at home and fulfill his final wishes. It was able to help him to live independently and stay at home while on hospice services.
My patients have used the We Care Emergency Assistance Fund in a couple of ways. The first patient, his truck was stolen, unfortunately, and his wallet was in the truck, so he didn't have any money to get his medication. He was becoming increasingly anxious, and he called our agency, and my supervisor approved me to be able to, we called CVS, and he called to get the approval, and I used the credit card to get his medications for him, and he was so grateful.
One patient that comes to mind that utilized the We Care Emergency Assistance Fund is a gentleman that is raising 2 smaller children on his own. His kids were sharing either the couch or a blow-up mattress, so we were able to get the funds from the We Care Emergency Assistance Fund to apply for furniture from the Cleveland Furniture Bank. The bunk beds made a difference in their lives because it provided more stability to their home life. They had, their own beds, their own part of the room.
We should continue to donate to this fund because it's a critical need. People misunderstand and think that maybe these funds are just for the indigent, but that's not necessarily the case. It could be you or I, just down in our luck, or maybe our check didn't come in soon enough, or maybe there's a transition between insurance companies and we were able to satisfy the need because they couldn't get their medication any other way. So it's really for anyone that we determine has that strong need.
This fund is definitely something very amazing. The We Care Emergency Assistance Fund, a little bit goes such a long way. I know personally I donate out of my check, and seeing the money put to work is amazing and beautiful.
When people think about donating, I think a lot of times people think they need to give a big donation. But I think if you just donate $1 or $2 a pay period over time, that in and of itself will accumulate.
This is something that could mean the difference between an emergency room visit, going to the hospital, or staying home and getting their need met for that moment. And I don't know too many other agencies that do what we do.
My name is Pat Schenker. I'm the Human Resource Business Partner at the Visiting Nurse Association of Ohio. Many of our staff members have been in situations where they are in crisis and need of support. Our staff always rally to support each other, but this fund is true safety net for them for when they need it. This year we are approving the employee assistance request through the We Care campaign. It really is people helping people, and our staff members are so grateful for this type of safety net assistance.
Thank you for making a difference in someone's life.
Thank you for making a difference in someone's life.
Thank you for making a difference in someone's life.
Thank you for making a difference in someone's life.
Thank you for making a difference in someone's life.